This is James Burkhart. We're doing an advanced health assessment. It's May 3 of 21. Hi, how are you doing today? I'm James Burkhart. I'm a Purdue University Global Nurse Practitioner student, and I understand that you come to the clinic today. And what is your name?
SG.
SG, okay. And do you mind if I call you Miss SG?
I don't mind.
Okay. Miss SG, what is your primary language?
English.
English. And I'm going to ask you some health history and everything, and also what you come in with clinic and that sort of stuff. If you're okay with that?
Yes.
Okay. And how old are you?
33.
33. And when's your date of birth?
4/6/88.
And where were you born?
Jackson, Mississippi.
And what gender do you identify yourself with?
Female.
And what race do you identify yourself with?
African American.
And are you married?
Single.
And is there anything culturally, ethnically that you'd like to be aware of that might prohibit any kind of care we may offer?
Yeah.
And what's your highest education?
Bachelor's degree.
And what do you do for a
I'm an actress. I'm an actress.
actress? Okay. Great. And we already have your health insurance information on file with the office. And one of the considerations we want to do is make sure that if we're going to refer you to someone that we have that information. Okay. And what brings you to the clinic today?
For some reason, I have bad stomach aches after I eat eggs and cheese and stuff. Dairy products. And it's been going on for quite some time now, and I finally decided to come in and see about it.
And when did this start?
About 6 months ago.
6 months ago. And you said this is after you eat
Dairy
eggs,
products.
dairy
Eggs,
products.
cheese, milk, drink some milk.
And what kind of symptoms? How does it feel?
It feels like gas. Just feel like something roaming around my stomach. I don't know if gas moving around.
Where does it start at?
It starts at the top of my stomach and moves around my whole stomach, like kind of like a cramping sensation.
And how often have you been getting these symptoms?
Usually after I eat, I say I probably eat it like 2 or 3 times a week. The dairy products. So that's when the symptoms appear.
And does it come on suddenly?
Yes, I would say yes.
So after you eat it, dairy products, it comes on suddenly. And then how long does it last?
Sometimes it can last about 2 hours. So I go to the bathroom and then I feel relief after I go to the bathroom. Like have a bowel movement.
On a scale of 1 to 10, with 10 being the absolute worst symptom you can think of, how would you rate that?
7.
And is that pretty much consistently each time it's about that
Yes.
that noticeable? And, when you have your bowel movements, what does your stool, does it look normal to you, or is it change?
To be honest, I don't look at it. Just look at it.
And you hadn't noticed diarrhea or anything?
It feels like I'm constipated though when I'm sitting there. I have a hard time pushing it out.
And is constipation normal for you at all?
No, not really, no. You don't have a problem using that.
And how many times do you?
Once a day.
And you eat dairy products, the number of bowel movements that you have during that day, that 24-hour period,
It's
that
twice a day.
increase
Yeah, yeah,
twice a day. And you mentioned that you believe it's caused by dairy products.
That's what I think, because that's when I noticed it. My stomach aches and it have to eat that after I eat the dairy.
And have you noticed any other changes, any reflux, acid reflux associated?
I don't know, but sometimes I have burning in my chest. So I don't know if that's acid reflux. My chest get real hot. And I don't take anything for it. I just drink some water. Shortly after it goes away.
And that's after you eat dairy.
Mm-hmm.
Okay. And the word it helps it. And what kind of medical conditions do you have?
Uh, high blood pressure is the only thing that I know of, and high cholesterol.
And during when you were growing up, did you have any measles, mumps, rubella,
Chicken pox. I had chicken pox when I was 5 years old.
And you still have your tonsils?
Yeah.
And what kind of surgeries have you had?
Just had a C-section.
How long ago was
About 10 years ago.
it? Was it a total C-section or was it? Did they take your uterus and your ovaries or? Okay. Oh, I'm sorry.
You think of history?
Yeah. Okay. How many times have you been pregnant?
2 times.
And you carried to term both, or?
Yeah, the second one was born 2 weeks early.
And how many babies do you have? Children?
Okay.
So you never had any abortions?
Yeah, I had an abortion.
Abortion.
Yeah, about 5 of them.
Yeah, 5.
Yes.
Okay, so you were pregnant 7 times.
Mm-hmm.
Okay. Were they missed abortions or were they? And when was the last time you were
10 years ago.
pregnant? Okay, so that was the last time, and you had C-section for both of those.
Mm-hmm. Just one.
The other one was natural. Let's see, and are you? I assume you got a bachelor's degree. Did you get all the normal required vaccinations for that?
Yes, I did.
And did you have you gotten your HPV vaccination?
Yes.
Did you ever have to get a varicella vaccine?
Yes, I did.
And are you current on did you get your flu shot?
Yes, I did.
And how about the COVID? Have you got
No.
And any mental health issues, any depression or anything like that?
No.
And are you allergic to anything? And are you? And when was the last time you saw a provider?
Last June.
Last year. And what kind of provider was it?
It was a regular doctor.
What was the reason you went over there?
Because I was having chest pains.
And what was the final diagnosis? What did they do?
They just gave me a breathing treatment and told me to exercise and stuff.
Did they do any kind of heart-related stuff? EKG, stress test? Have you had any chest pain since then?
Nope.
And are you exercising regularly?
Yes, but I kind of slacked up. I need to start back.
When was the last time that you did exercise?
Exercise about a week ago. Walked for about 2 hours.
How would you describe your activity level?
Moderate. You could be better. Gotta fit in that time.
And what kind of diet are you eating?
Whatever. It's nothing ridiculous. Try to do low carb, but it don't necessarily works out all the time.
I understand. Busy schedules.
Yes. Take care
I understand. But now are both your parents still living?
Yes.
Okay. And what kind of history, what kind of health, is, uh, any kind of diseases with your dad?
I don't know hypertension.
And how about your mom?
Fibroids, breast fibroids in her breast. She got high blood pressure, real high blood pressure.
And are both your grandparents living?
My grandma died of colon cancer. Granddad died before I was even born. Heart attack.
And do you have any siblings?
Kind of was,
Yes. Okay. How many males and how many females?
five. Well, my mama lost one, so it was 4 girls, 5 boys.
And was it that you were born?
Well, she don't know she baby
Okay.
like miscarried.
And did any of your siblings have any health issues?
My oldest sister, as far as I know, high blood pressure. Really? Sure, they don't really go to the doctor like they're supposed to.
Do you normally get a wellness check every year?
Yes, I do.
And spiritually, religious wise, is there anything that you prefer?
Non-denomination.
And health, how do you how do you feel that how healthy you are?
Yeah, I'm healthy. Like, I don't have, on a normal basis, no breathing problems, no aches and pains. I feel like I'm healthy.
And have you been avoiding urinating fine?
Yes, I have.
Okay. Any, have you noticed any kind of difference in that at all?
No.
And have you had any trouble getting up in the morning, moving around? And have you felt like you've had any kind of um, unusual stress lately? Anything?
No, not really, no.
Sorry. And have you had any problems remembering anything?
No.
And how about your sleep? Have you had any problems with sleep?
Um, Waking up throughout the night, every couple of hours awake. But I think that has a lot to do with my mate. Gets up in the middle of the night owl, about nights. It wakes me up when he wakes up.
you have do you do you prefer men or women or
Man.
men? Okay. And so do you live with this? How about sexual? I assume you're sexually active. And do you have any do you have him as a sexual partner?
Yeah.
And how about any tobacco use, using tobacco products, and any alcohol?
Occasional social drinker.
How many drinks would you say you normally drink in a week?
I said about 3.
And any illicit drug use? And have you had any weight gain or losses lately?
This is standstill.
Have you felt like you were fatigued or no real energy, anything unusual? And have you had any fevers recently? And do you have any moles on you or freckles? Have you noticed any kind of skin itching, unusual itching, or anything like that? And any change that you had any hair loss? And how about your nails? Have you noticed anything changed with your nails? You have any headaches?
Yes, when I don't take my blood pressure medicine, I have a sharp shooting pain on the side of my head. Which I went to my primary care doctor for also. They didn't do any x-rays or any, any exam MRIs.
How long ago was the last time you saw the provider for that?
In June.
Okay, it was. You currently have a headache right now?
No. As long as I'm taking the medicines, I'm fine.
Okay. And have you been able to get your medicines okay?
Yeah.
You take it regularly? Have you had any dizziness? Anything feel like your brain's spinning around or anything? And how about your vision? Do you wear glasses or contacts?
Both of them. I wear glasses right now. Contact.
And have you had any double vision, blurred vision,
Yeah, blurred,
aside from not wearing them?
No.
What was your last eye exam?
I think I did in August. August of last year.
Okay. Any changes?
Yes. The right eye, they had to change it. Worse than the left eye.
Okay. And you see your eye doctor?
Yeah.
And have you had any ringing in your ears? Any pain in your ears?
I did notice ringing in my ear the other night when I was drinking. And I wasn't sure if it was a side effect of the alcohol. But it stopped after I went to sleep and woke up.
And you currently don't have any ringing?
No.
And you're able to hear fine, any no hearing loss or hearing aids? And have you had a cold recently?
No cold.
And do you have you ever been told you have hay fever or any kind of allergies to the outside environment? Any changes in your sense of smell? No. How many nose bleeds?
No.
This time of year, have you had any kind of pressure? Felt like you have any kind of
There's
Pressure up in
pressure
there.
right here in my head, right here. I don't know what that means, so I just massage it and it goes away. Feels tense.
Currently it's hurting right now.
Not right now. The other night.
Did you take anything before that?
Mm-hmm.
How often do you have that?
It comes and goes periodically. I say a couple of times a month. I don't know if it's due to stress of unknown source.
And I have teeth hurting. Do you have all your teeth?
No, I had to get a root canal. I had an abscess on my teeth. Woke up one morning, my mouth, whole side of the face was just swollen and tight. I had an infection. They said my tooth was loose.
Okay.
So they had to take
How long ago was that?
right before COVID.
So about a year ago.
A year
So,
ago.
okay. Have you had any contact?
Yeah, the other side started hurting the next year. So had to get a root canal.
And so when was that other root?
Last year, last the benefit, like February, like February.
You just went for 2 for 1.
Yeah.
2 for 1. Okay. Have you had any soreness in your neck area at all? No. Have you been able to turn your head normally, like any changes in that? And do you examine your breast?
Yes.
And how often do you do that?
Around the time of my period, I can't think of this before or after. I think it's after.
So every month.
Every month, yes.
When's your last mammogram?
I haven't had one of those in a while. Say over a year ago.
During your examinations, have you noticed any kind of lumps or anything like that? Any changes? Any unusual tenderness in your armpits or anything like that? And how about any coughing? Have any coughing lately? And have you had a chest X-ray recently? Have you ever had a TB skin test?
Yes.
When was the last time?
A couple weeks ago. It's about 3 weeks ago.
It came back okay.
Yes.
And then you had chest pain about a year ago, so you've had none since then, right?
Yes.
Okay. And any kind of swelling, unusual swelling in your arms or your legs, any kind of bluish tinge or anything like that. Any trouble when you get up in the middle of the night, or any kind of inability to move, or and have you ever been told you had anemia?
No.
And any of you ever been told that you have heart murmurs? And do you use have you ever have you been exposed to HIV? No, never been diagnosed with HIV. And how are your menstrual cycles?
Regular, every month, 5 to 6 days.
Any unusual, heavy bleeding, any pain
Normal cramps.
associated? So, and any pain during sex.
Um,
And have you noticed any kind of tingling in your fingers or your feet? Any numbness? And have they felt unusually cold to you? And do you have any, you ever been told you had blood clots before? And any kind of joint pain, any history of arthritis,
nope.
any kind of back pain,
No.
and any kind of stiffness.
No.
And do you ever have any hallucinations and any kind of mood changes? Any times where you feel like hurting yourself or someone else? And you currently don't feel like hurting yourself. And do you bruise easily?
No.
Any kind of bleeding? And when you've looked at I know you haven't looked at your stools or anything, but have you noticed any kind of red bleeding that you noticed, wiping? And how about, have you had any excessive sweating or, and how about, have you had any kind of, when you get up in the middle of the night, are you having to void
Yes.
every 2 hours?
Yes.
So, any, does it hurt when you have to void?
No, it's more like a pushing, burn down feeling like I gotta make it come out. But you have a sensation of pee,
Mm-hmm.
but you can't pee, but you can pee. You just stay there long enough. If that makes sense. Do that make sense?
That's just any diabetes, anything.
My grandma, my daddy, grandma.
And have you ever been tested for diabetes?
Yes, it's been normal, less than 7. It was like a 5 or something.
And when was the last one? When was the last time you were tested?
When I went in December, I had to go for my medication refill. And they do some blood labs and stuff.
You take you don't you do.
No,
What kind of medicines do you take right now?
blood pressure medicine.
Do you remember the name of it?
Lisinopril.
How long you've been taking?
About 3 years now.
What's your dosage?
10 milligrams.
Is that once daily?
Yep, daily.
And do you take any over-the-counter medicines?
Yes, I take ibuprofen for the headaches.
How many pills of those do you normally take?
3.
You take 3.
200 milligrams.
Okay. And when you take those, do you take those with food or do you take those with water?
Water.
Have you noticed any kind of, when you take those, have you noticed any kind of system? Do you take anything for heartburn or and take any herbal supplements?
I take a fiber pill.
You remember what the name of that is?
It's like fiber on the bottom.
But it's in the herbal section of the store. And do you have any questions for me?
What do you think is lactose intolerance? My stomach from your reviewing it.
What we'll do is we'll compile this information and everything, and then we'll talk about diagnosis.
Okay.
Here.
All right.
All right. Well, this concludes our health assessment. I think you're being such a good participant.
No problem.